Hello everyone, this is Joni, and I would imagine that you were thinking, what in the world is she doing on here filming with a towel around her head? And I have had my viewers wanting to know what all is going on with me, why I'm not making any videos or anything, and I wanted to come on and explain to you as best I can what's going on, and my towel is trying to fall. The reason I have my towel on is I haven't been able to shampoo my hair for well over a week, and you are seeing the true me. I have not one drop of makeup on of any kind, and as you can see, my nose, I have a huge bandage, and it's really pretty, I'll tell you. You haven't lived until you have one of these, and then you can probably see I have a gauze-like thing coming down under my towel here in the back, and that's because I had surgery on my nose because it's really up here almost in between my eyes. I had a malignancy removed, a malignant tumor, and it had to be removed, and they had to do skin grafting with it. And they went behind my ear to get the tissue to put up here on my nose. And so I haven't been able to, they told me just total rest. Nothing, no kind of exertion, no lifting, nothing other than surviving and just walking around. Really, I wasn't supposed to walk around that much. Just doing what I had to do, and like I said, to survive. And my daughter has still been preparing my meals for me and everything, and she brings my food up for me, and being an RN, which has helped me immensely, she worked in surgery, so she knows what this is all about. So she has been dressing this place behind my ear because it had several stitches back there. I forget how many. I think it was 12, something like that, 12 stitches back there, something like that. I can't remember for sure. But anyway, this thing, I haven't been able to do anything, and they said not to even get it damp. So when I can't even wash my face except to take a washcloth and put water on it and then wring it out as dry as possible, and then just wipe very gently across my forehead. And I don't think if we realize how much one part of our skin, if we move one part of it, how it affects the other part. And I can take and move my skin, maybe it's just my skin, I can move this skin just a little bit and it affects the skin on my nose. Well, I have a skin graft there trying to grow back and to form a natural looking skin and nose there, and so I can't wash my face like I want to, and with all these bandages and everything, you can't get near them because they said not near. I can't bend over. The limitations far outgo the ability of doing things. I mean, the capabilities or whatever. And it is ridiculous. And so I've had places removed before from me that were malignant, but I have never had to have any skin grafting before. And I got this one doctor, my daughter had told me about him, and she said that he was the best, and that we have down in this whole area. And so I had to wait for a while before I could see him, but I chose to wait. And he has been tremendous. I mean, tremendous. Um, he looked at my nose, and I had been told, just like every time I get a place like that, the doctors say, no, that's nothing, don't worry about it. So I was told about, I don't know, a year ago, no, that's nothing, it's not malignant, don't worry about it. If you're still having trouble in 6 months, come back and we'll take a look at it again. So I waited on Dr. Hinghold to see me, and he had been very, very busy and everything. And so I waited for it to see him, and then when he looked at it, he said, yeah, he said, that looks suspicious. He said, we're going to do a biopsy on that. So he performed a biopsy, and it came back malignant. And so he said, let's set you up for next week, surgery. So that's what we did, and I had it, and it's been well over a week now. I go in tomorrow to have the stitches removed from behind my ear, but and this pad here, he's going to remove it, but he still is going to put some other pad back on top of that, because I guess that he doesn't think that the skin graft has had time to grow like he wants it, and I can't get it wet or anything. I'm hoping I haven't been able to take a shower. I can wash, but I can't get in a shower or anything like that. And I'm hoping that at least I will be able to take a shower and not have to just wash with a washcloth and soap and things like that. And because I'm used to showering every morning to the world, and I wash my hair every day because my scalp is very oily. And so I'm just hoping to get back to my normal routine. And so if he puts another bandage on there, though, I'm going to be limited. I don't know if I'll have to wait and see if he wants. I wouldn't think he would want it wet either, though. So I don't know. Maybe I could get a shower cap and put it down over my nose or something. I don't know. And I'm thinking of all these things, trying to think ahead to see what I could possibly do, but I'm sure that he will know. But he even called me the night after, it was the night of or the night after my surgery. I'm not sure which it was. He called me and to see how I was doing and if everything was going all right. And I appreciated that so much, because you just don't get doctors that do that these days, especially doctors who are so busy like he is. He has his own clinic, and he has his own surgical unit, and he has all these other doctors and everybody working for him and everything. So he is a really super good doctor, and I would recommend him highly to anyone who is needing some kind of skin surgery or something like that. And I've been very fortunate with my doctors to get ones who really know what they're doing. And this place that I had here, it was removed about 35 years ago. And I never had a problem one out of it. And then here it grew back, and it came back on, and you couldn't even really, you could not see the incision where it was taken away. But just a little bit, once in a while, when I had no makeup at all on, you could see just a slight little bit of a scar there. And I noticed one day that there was a red place on one side of the scar. But I didn't pay any attention to it because, like I said, it had been 30-some years ago. And I had a large malignancy removed here. The incision was about 2 inches long there. And the doctor that did that for me, you can't even tell that I have that incision at all either. And I scar really badly too. But due to what he did, you can't tell. Anyway, so then about a week went by, and a red place came up on the other side of the incision on my nose. And I thought, that's not good. That's coming up around that incision. It's exactly where the other one was removed. So, what do I do? But I begin to worry, and I know that the doctors cannot tell if they're malignant or if they're um, uh, just regular skin, just a pimple or something, or just a discoloration of my skin. So I started just worrying about it, is really what I did. And I thought, well, I have time. I'm not going to get in a hurry because I didn't want to drive all the way back home to have it taken off. And then my daughter told me about Dr. Hinghold. So, like I said, I went to him. And he is fantastic as far as I'm concerned. So I'm going, like I said, tomorrow to have this taken care of, hopefully, and hopefully it will be growing really well. I mean, good, and it will be fastened down. And it took forever to get the skin sewn on there, and I guess that they have to be very, very careful when they're sewing it back. And I did not feel a minute of pain or anything. And he sent me home, and I took two extra strength Tylenol, and that's all I had to have with the whole surgery. And now, did it hurt? You're daggone right it did. But I'm the type that unless I am in severe, 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 severe pain, I don't take medication. So I took, now, like I said, two extra strength Tylenol. I didn't have to use ice pack. Didn't have to do any of that because I know me, my sinuses, I have bad sinuses. And if I put ice on my head, I would have had a sinus infection. And I know that would have compounded the nose problem because I had just been sick well, I went to my daughter's Christmas party, and Sophie and I went. And we were just having a great time. We were having so much fun, and we all did at our party. And everything, we came home, and somewhere I picked up a bug. And I got so sick, and I was in bed for all through Christmas. My son-in-law had come over before I got sick, and he brought all of my Christmas stuff out for me and set it in the living room. He put my tree up, the tree, bare tree up, and some other trees. And I fixed my pencil tree and put it up in the kitchen. I didn't get through with it though because I was going to finish it the following morning, and I got sick that night. I was carrying a temperature. I had to go on antibiotics. I couldn't get out of bed for well over a week. And Tanya, I would not allow any of my son, Chris, or Tanya, none of the families of her family or his family, to come to my house during that period. So my tree is still sitting bare in my living room. It didn't have an ornament one put on it all through Christmas. And I was just getting ready to start taking the stuff down, that was sitting around. I had just some things sitting on the couch and here, there, and yonder in boxes. And I was getting ready to start reloading those things back up that were on my coffee table when I had to go for my surgery. So then that put me back again in bed for a week. I couldn't lift anything, couldn't bend over, and couldn't strain, couldn't do anything. So I was really, really sick, and I didn't. Christmas, Tanya fixed a big dinner at her house, and she brought all of the fixings and everything for Christmas turkey and all such things over for me. But I spent Christmas alone, and that was my choosing because I don't want my kids to get what I've got, and so I chose rather than to have them get it. And she would FaceTime me. All those things are worth their weight in gold when you're sick like that. She would FaceTime me and sit there and talk to me, and it was just like as if she had come over for a visit. And so it was really very, very good. Just for that, I would have bought the iPad just for that. And at least I did have a little bit of conversation. I mean, she always talks to me on the phone all the time, and she comes over to visit me once or twice a day. But still, through Christmas and New Year's Eve, there was no New Year's Eve for me. I was still sick with that crazy virus. I thought I was never going to get over it. And so all of that started. And before that, I have not had a very good fall at all. And I know that all of you were writing me and asking me what's wrong, why are you sick, why do I see so many doctor's appointments in your planner and all this stuff. And I was getting ready to make a video when I got sick. And so I might as well tell you that and get that over with too. I had an appointment with my doctor, and I went to, I had some blood work she wanted me to have done. So I went to have my blood work done, and I came back home, and Tanya went with me to the doctor. She always goes with me when I go to the doctor. And she went with me, and she went in the office with me, in the examining room. And she was sitting, and I was up on the examining table, and she was in a chair down here at my feet. So the doctor came in. She said, I have a nurse practitioner with me today. Would you mind if she comes in and talks to you? And I said, no, I don't mind. I said, that'd be fine. So she comes in, and usually when I go see my doctor, I'm doing pretty well if I get to talk with her about 10 minutes, something like that. And the nurse practitioner kept on going on and on and on, and I thought, this is unusual. So an hour passes, and she is still talking about my history and all of this and that and something else. And my daughter is sitting down there, and she's holding her purse and my jacket and everything. And so 3 hours later, we were still sitting there. And I'm thinking, this is highly unusual. I don't know what's going on. And so then she is casually, just in a casual sentence, I don't remember exactly what the sentence was, she said, but said when you're in stage 3 of kidney failure, you have to be a little serious about it. And about that time, I looked at my daughter because it hit me about like it did her, because her being a nurse, of course, and a good nurse, I must say. I've had 2 doctors tell me that she was the best nurse they've ever worked with in their professional life. And so she looked at her like, what are you talking about, stage 3 kidney failure? And I looked at her, and she raised about a foot up off of her chair. She looked me dead in the eye, and she said, Mom, do you hear me? Where 2 believe and believe together, it will happen. And I knew exactly what she was talking about. She said, do you hear me? Because the doctor and the practitioner was talking. And I said, yes, I hear you. I know what you're saying. She said, okay, remember that. And she just sat back down. And then she started asking questions about results, blood work, and all of this stuff that I didn't know diddle about. And they started saying my liver was not functioning properly. My blood work did not come back right. And all of this and that and something else had gone wrong. And I couldn't understand why I've gone to this same doctor for about 20 years now, probably 18 to 20 years. I couldn't understand why she had allowed a nurse practitioner to tell me that I was in stage 3 kidney failure. That kept just going around and around in my mind. Why did you allow a stranger to tell me that? And I hadn't had any pain. Tanya and I were laughing. We had plans of going to Michael's directly after the doctor's appointment. And we were just having a good time. So she keeps talking, and she had diagnosed me as being a diabetic. And they started reading my readings, and it turned out that my sugar readings were running around 14 to 15, and I knew that that was not a diabetic, because that is like if you eat a meal, sometimes it can get up to 30 and 40 within an hour after you've eaten. And so I said, I have always been a borderline, but I said I've never been diagnosed, except one time I was. But I lost 40 pounds and it went away, and I hadn't been bothered since. My nose is paining right now. But anyway, I said, I don't think that I have that diabetes. And so we left the office with the stipulation that I was to come back. I don't remember when it was to go back, but anyway, I had to come back. And I had endocrinologist, I don't know what all different. I had to have a CAT scan. I had to have all of these different testing things that I had to go through that she gave me papers for, and she was sending me to, it was 3 other doctors. That's why I had so many doctor's appointments in my planner. They were different doctors for different conditions. One for my liver, one for my sugar, one for my kidneys. She said I couldn't go to my regular kidney doctor because it would take a kidney specialist. Well, he is a kidney specialist because he's the one that took my kidney stones out. So anyway, Tanya comes home. She doesn't say a thing to me. She just looked at me. She says, I don't want you to worry about this. She says, I don't believe that there's anything wrong with you. And she said, we are praying, and we have turned this over to God. And so she comes home, and unbeknownst to me, she calls my son. Well, my son is the kind of person that he's a lot of fun. He's as good looking as they come. He's a big old 6-footer guy. And as Sophie says, she looks like her daddy. And I was in bed, and I think I was probably watching some of the crafting shows. And because when my mind would start to go to, oh, this or that, I'd say, no, I'm not going there. I don't have any of that. So the phone rang, and I answered it, and he said, Mom? I said, well, hi there. I said, what are you into? And he said, Tom called a while ago and said that you're having some problems. Cool, calm, collected, no urgency, nothing. I said, yeah. I said, they said that I'm in stage 3 kidney failure. He said, no, there's nothing wrong with you. We will not accept that. And he said, I will tell you how we're going to deal with that. He said, I am turning that over in Jesus Christ's name right now. As of now, there is nothing wrong with you. You are fine. Do you hear me? And just like Tanya, I said, yes. I said, I hear you. He said, okay. And he said, I'm praying. He started praying. And he prayed, and he said, take anything that was ever thought to be wrong with her away, do away with it, and in the name of Jesus Christ. Amen. He said, Mom, you're fine. I'm late. I got to go to work. That's the way he is about his work. If he has to be at work, he is at work. And if he can work any job he goes on, they want him to become the boss over the job. And he is a very intelligent guy. And everybody thinks very highly of him. He plays a trap set, and he can make those drums talk. And I listened to him play drums when he was all through junior high and high school, and he came home with blisters as big around almost as, bigger than bigger radishes, where he would starting out carrying that big bass drum. Didn't say a thing about it. He loved it. So then he graduated to Tri-Thompson, all that stuff. But anyway, so I went back to the doctor. I went to the three doctors, and the one doctor said, "I'm sorry." He said, "I can't find anything wrong with you." He said, and he did another blood test to make sure. And Tanya and we went on shopping after we left the office before we came home. And then we were out shopping again. And the doctor that I went to, Dr. Brown, he is another excellent doctor. I think he was the endocrinologist. And he called, and Tanya picked up my phone because I was checking through the cash register. And she answered the phone, and I was glad because her being a nurse, she could talk with him more on his level. And he told her, he said, "I am so happy." He said, "I just couldn't let your mother go home thinking that there was something wrong with her blood." He said, "There's nothing wrong with her blood work." He said, "It's fine. She is absolutely normal." And I said, "Thank you, God." Just like I did when I lost my debit card that time, I thought, and I put my hand down after I had emptied my purse 5 times. I put my hand down in and it hit it the first time. I said, "Thank you, God. I needed that." Well, I needed this too. The other doctors said the same thing. There's nothing wrong. The only thing that did turn out was this thing. And I'll take this that can be removed, and which has been removed, because the way the doctors are doing things now, when you have a malignancy removed, you have to wait 10 days until the lab gets the report back. Well, him having his own setup there with the hospital, his own building and everything, he is my pathologist also. So he checked the stuff he took off of me as he took it off. And he went until it was clear. And then the nurses came back and said, "You are clear." And then when he finished with all the pathology and everything, he came back and he said, "Mrs. Lowe," he said, "you are clear." He said, "You're fine." So now that will bring you all up to date, and that will tell you why I was having so many doctor's appointments, and I couldn't say what was going on because I was still waiting for the results to come in from my other blood work and my other different labs and things that they were doing on me, kidneys and things like that. And I didn't want to jump ahead of all the reports and everything, even though I felt thoroughly contented in my heart that there was nothing wrong. And the kids were thoroughly contented that there was nothing wrong. And so I told Sophie, I said, "I know who there's always been someone." I grew up in a Christian family from the time I was born. That's all I knew was a Christian family. And it's remarkable of how that changes your view on things. And so when you hear something like that, yeah, it does. It sets you back because it aged me a good 15 years. And I would put on concealer under my eyes, and I would have to put it on maybe 4 times. And I still could not hide the blackness there, the dark skin that had appeared after I was told that. Even though I wasn't worried, subconsciously, I guess, it was doing something. But anyway, Now, hopefully after this is over, but now I have another red place right here, and it's equally almost as bad as the one as far as the color of it and everything. And it feels like, I don't know if you know what insulation feels like when you get it on it, but my husband was in building houses and everything, and if you get insulation on you, it feels like you have pins and needles running in you. And so I know quite well what it feels like. And when I go over that, if I go over it too hard, it feels like there's insulation, little pins pricking you there. So I will leave you with this message. When you go out into the sun, please, please put on your sunscreen. And if you're going swimming or if you're perspiring or something, reapply it when you feel that you need it. And don't get sunburned, because you can get a beautiful tan just by getting a little bit of sun one day and a little bit of sun the next day, and then it builds up into a beautiful bronze without, and you still have your sunscreen on there to protect you from those ultraviolet rays. So don't do like I did. When I was young, I didn't use sunscreen at all. And now this makes probably about the fourth or fifth thing I've had removed, malignancy that I've had removed on my face. And you don't want that. So my towel is drooping, and it's getting softer and softer as I'm sitting here. But I've got a big weight off of me now. I know that you all know what all the doctor's appointments were about, and I've answered that part of it. I didn't want to tell you that I would do something and then not carry through with it, because if I tell you I'm going to do something, I want you to believe that I will do that. And I said, as soon as I get straightened out, I'm going to tell you all what's wrong, what has been going on with all of my medical problems and things. So that's what that was all about. Then I got sick over Christmas, and I was going to tell you about that, why I didn't have my house up to show my Christmas decorations. I had things, my goodness, that I have not even started to unpack for last Christmas. And I was going to get all of that out and put it up. But it wasn't to be. So I'm not going to dwell on that now. And I'm hoping to be able to decorate a little bit for Easter. I don't decorate a lot for Easter, but I think that I just had a few eggs, and I used to make Sophie's Easter baskets and things like that, but I don't do a lot of decorating like that. And I'll probably make a few DIYs for it like that and things like that. But just know that I am okay. And as soon as I am able to come in here, and I tried to cut 2 papers last night to go in my planner. And, oh, by the way, you all know I use readers. Well, I can't put my glasses on now because they would not even start. I wouldn't, even if they told me I could, because I want that skin to grow back quite nicely. And there's no way I could get my glasses on. So when I do any reading, I have to put my glasses up like this with the rim, with the ear things out that way, toward you, in other words. And then I put it there, and then I read. And when I try to type a comment, I put it like this and try to type the comment, and I can't tell if I'm actually getting the right key or whatever. It's hilarious. And so that is what I'm doing for reading and everything. So now I'm still not going to be able to use them even after tomorrow. I'm thinking if he puts another bandage on there, because he's not going to want glasses sitting on top of that, on my nose anywhere. So I'll still be hunting and pecking and trying to find whatever I am with my glasses. So you guys know I haven't forsaken you. I haven't run away from home. If I had, Tanya and Chris would be after me. And so I'm hoping that everything is going to go well. And I feel quite sure it is, because he did get all that cancer and everything. Now, if I can just, and you talk about itching. Oh my gosh, from here to here, I itched until I felt like I had poison ivy. And behind that ear, that's a very delicate place. I didn't realize that. He says your skin is more like your skin up here behind your ear than any other place on your body. And that's why he went behind the ear and down on back and shaved a little bit of hair off there to get what he was wanting. And or to get as close to it. And my ear would itch, and when Tanya would come over to clean that, I would say, please just rub around it a little bit if you can, because it feels like I have ants crawling on me. And you just want to reach up there and just scratch as hard as you can scratch, but you can't. Now, I have hit the tip of my nose twice with my finger when I was asleep, because even right here on the tip of my nose, it itches something terrible. And I would take my hand to go like this, and I did it harder than what I meant to. I mean, it wasn't really hard, but it was harder than I meant to. But I've been on here too long, and I'm sure that Tanya will say, Mom, you should not have stayed on here that long. That's the way she's always done. But I feel relieved, and I can sit back, and I was telling you about my papers. I want to tell you my glasses, but I cut 2 papers and cut the little boxes out. And I would get one level down here where I was supposed to have it, and by that time the one up here would be out. And here I would be holding this glass like this and trying to move this paper with one hand. It just doesn't work out very well. So I cut 2 pages. Now, if I want to fix some more of my planners, and I'm still not able to wear my glasses, I'm just going to have Tanya cut my papers out for me, and then I can glue them down, but I just can't cut them and hold them straight. Oh, that nose is itching. It itches up under this bandage here until you don't want it. Anyway, you guys take care of yourself. And I've been watching your videos. You all are doing marvelous work, and you're very entertaining. And one girl, I could watch her all day long. She is so uplifting, energizing. She cleans like there's no tomorrow, and her house is spotless when you look at it. But she's still cleaning. But oh my goodness, I can see why it is spotless. And I love to watch all of you. I do. I truly do. And you have kept me entertained, and I thank you for that. And just know that I am okay, and I can't wait to get back and start making my own videos so that maybe I can have a little bit of entertaining value to you. And I'll just say goodbye. Not goodbye, so long. My father never would say goodbye. When we would leave to go home or something, he'd say so long, because he wouldn't say goodbye. That was too final for him. And so I'll say so long. And maybe sometime when you come back, we will be crafting. But I'm hoping that's not going to be too terribly long. So I'll talk with you guys later. Bye-bye.